Below presentation. Student Jacqueline Villon Cruz, teacher John Moscoso Escobar, nursing student, Catholic University of Santiago de Guayaquil, Faculty of Medical Science, nursing course, Facebook, Instagram and Twitter Jacqueline Villon Cruz. Suvival answer minimizer invasive radical hysterectomy for enhancing stage cervical cancer. Definition: cervical cancer is epidemic carcinoma. Infects by infection with the human papillomavirus. Less frequent is adenocarcinoma. Cervical cancer is the second most frequent cause of the worldwide. Thus, there are one invasive and non-invasive therapies that seek to impact. These are Suvival.
Our study found that patients undergoing minimally invasive surgery, which basically means laparoscopy or robotic surgery, for radical hysterectomy in early stage cervical cancer have a high propensity for recurrence and a high rate of mortality. Traditionally, the radical hysterectomy have been done through an open surgical approach, where typically patients were hospitalized for several days after the surgery, and generally the recovery took anywhere from 4 to 6 weeks. The minimally invasive approach is where the same procedure is done, but only through very small incisions, where patients generally are going home the next day after the surgery, and generally the recovery is much sooner, so typically within 2 to 3 weeks patients are back to their normal functional status. I think it's important for patients to discuss minimally invasive surgery for other types of cancers other than gynecological cancers. Certainly there's differing data as it pertains to different diseases, so therefore it's important for the patient to discuss with their surgeon as to what is the safety of that particular approach for their particular cancer. The results of our study certainly were not expected. The retrospective literature had shown that the minimally invasive approach was equivalent to the open approach. The retrospective literature focused primarily on surgical outcomes around the time of surgery. The retrospective literature did not focus very much on cancer outcomes, and that's critically important. I think it's very important for all patients who are recommended a radical hysterectomy for early stage cervical cancer to have a very thorough discussion regarding this study with their surgeon, and particularly regarding the cancer-related outcomes.
Application in nursing. Extension of curative radiation therapies is there is spread to the parametriums on beyond. Radiotherapy and chemotherapies is there is spread to parametriums of beyond. Chemotherapies of metastases and recurrent cancer. Cervical cancer treatment may include surgery, radiotherapies, and chemotherapies. Hysterectomy is indicated. Books the pain does not want it. Radio plus chemotherapies use yours.
The new research applies only to women with early-stage cervical cancer having a hysterectomy.
This is high-level evidence that we should not continue to perform minimally invasive surgery.
Two major new studies find women who had minimally invasive hysterectomies, like keyhole or robotic surgery, were more likely to have their cancer come back and kill them than if they had the more invasive open surgery. Doctors are not sure why. It could be that some of the cancer is left behind in minimally invasive procedures, or that the instruments used might spread tumor cells. The results were startling and strong enough to change practice in at least one major cancer center, MD Anderson in Texas.
This calls for awareness that surgical approaches should really be tested with the same level of scrutiny as drug-related treatments.
The American Cancer Society estimates 13,000 new cases of cervical cancer will be diagnosed this year. 4,000 women will die of the disease. Erica Edwards, NBC News.
Pros and cons. Pros: radiation therapy and loss assured and generate. Used for early stage tumor. Chair treatment has been shown to be quite effective in treating early stage cervical cancer. Chemotherapy is combination of chemotherapy and radiotherapy is generally used on women who have a larger tumor and a very stage tumor located only in the pelvis of the lesion, not heart and cancer cells. Cons recommended from cancer is not already possible. Is and cancer cannot be cured or controlled. The design can be cancer aversion or terminal cancer.
When Dr. Janine Anderson had surgery for cervical cancer last year, she chose a minimally invasive approach using a smaller incision because recovery would be faster.
Being a mom, I wanted to be back to my family as quickly as possible. And then, as a physician, I wanted to get back to my practice, get back to my patients.
But just 16 months later, the cancer came back, and she's fighting for her life. Two major studies in the New England Journal of Medicine find that minimally invasive surgery for early-stage cervical cancer nearly doubles the risk of death compared to traditional surgery. Study author Dr. Pedro Ramirez says it's most likely because the instruments used in the less invasive surgery can spread stray cancer cells.
We needed to reevaluate our approach, and based on these findings, MD Anderson is no longer performing minimally invasive surgery for cervical cancer.
Dr. Anderson says had she known, she would have chosen a traditional surgery and not worried so much about getting back to work.
If it can help one person not to have to go through what I've gone through, I would love it.
The study results are so stunning, researchers say it could mean new scrutiny over using less invasive surgery for other types of cancer. Dr. John Torres, NBC News.
Hey, NBC.
Use applied in Ecuador. Consultation with a 5-year survival of 95 is 1%. In microinvasive cancer, extreme being radiation therapies with a total survival of 92.2% of 5 years. The chemotherapy with survival similar to radiotherapy, but with decreases the for surgery and the bacterial therapy combined with chemotherapy with short response in 74% of patients with stage cancer.
For early-stage cervical cancer, radical hysterectomy with lymphadenectomy is associated with cure rates of more than 80%. In 2006, minimally invasive surgery, either robotic or laparoscopic, began to be adopted as an alternative to open surgery. Current guidelines support both approaches. This observational retrospective cohort analysis of the National Cancer Database compared all-cause mortality for women with stage 1A2 or 1B1 cervical cancer according to surgical approach between 2010 and 2013. Of the 2,461 women with early-stage cervical cancer, 49.8% underwent minimally invasive surgery. These women were more likely to be white, privately insured, and from zip codes with higher socioeconomic status, and to have had smaller, lower-grade tumors. Over the 45-month follow-up period, women treated with minimally invasive surgery had reduced overall survival, with a 65% higher risk of death from any cause than women who underwent open surgery. The 4-year mortality was 9.1% after minimally invasive surgery, as compared with 5.3% after open surgery. Using the Surveillance Epidemiology and End Results database, the investigators performed an interrupted time series analysis to evaluate changes in survival after the adoption of minimally invasive surgery. Before 2006, the 4-year relative survival rate remained stable. varying only 0.3% per year. After 2006, the widespread adoption of minimally invasive surgery was associated with a decline in the 4-year survival rate of 0.8% per year. The authors conclude that in women with early-stage cervical cancer, minimally invasive radical hysterectomy is associated with reduced overall survival as compared with open surgery. Full study results are available at nejm.org.
Conclusion. Minimize invasive surgery Invasive for the treatment of cervical cancer in the early stage is your essential time and gut pathology, cervical and oncological result with long mobility.
This whole experience, I think, is humbling for us as surgeons that we have preconceived ideas of what is best, but that it shows us that we do have to evaluate things with level 1 evidence. It's as surgeons we like doing minimally invasive surgery. It's rewarding. We thought we were benefiting the patients, and this has really changed practice. I think for questions where we don't have answers, we have to really put forward those questions and try to advocate to have randomized trials to answer them. I think that's what this has shown. It shows that it's hard for people to absorb this data. I think our community is, and I think that people are making changes to practice. It also shows this study, these studies have also shown that the quality of life maybe isn't, quality of life in the LACC study wasn't really terribly different, no matter what the mode is. So I think that we can still offer good care regardless of the mode and ensure that we give these women the adequate oncologic outcomes, because this is curable cancer. And I think our study really highlights, like I said at the beginning, real-world data in a population where perhaps we were able to control for some of the variables that others could not.
Thank you.